Go.
Hi, my name is Jenny Curley. I'm a Cedarville University nursing student, and I'm going to be validating on NG insertion, feeding, and discontinuing. I'm going to wash my hands, check the doctor's orders, provide privacy for my patient, and ensure adequate lighting. Introduce myself to the patient. Hi, my name is Jenny Curley. I'm a Cedarville University nursing student. Can you please tell me your name and date of birth? I would check to make sure it matches the band. I'm going to be inserting an NG tube. I know the doctor discussed this with you already. Do you have any questions about that? If you think of anything, just ask me as I get set up. I'm going to raise your head and raise you up a little bit. As we get started, it's going to be a little painful, so if you need to slow down or stop for a second, you can raise this arm over here. And I'm also going to give you a cup of water for that hand, and when I tell you during it, you can take some sips of that water and swallow to help it go down a little further. We're going to assess the patient's cooperation, gag reflex, and which nair is more patent before I begin. I'm going to go with the right side. My patient a glass of water and check vowel sounds. Audible vowel sounds in all 4 quadrants.
Like, would you just do it, or do you want to? Oh, yeah, no, it's fine. I can leave here at 5. I'm not ready if I get it. Okay.
I'm going to check the tubing to make sure it's intact and it's not kinked or anything. And I'm going to wrap it in my hand to make sure to loosen it up a little. Prepare my tape. Going to measure the length of how far it should be inserted by going from the earlobe to the nose and then to the top of the xiphoid process.
Yeah, no, I know.
Mark that on here. And then I'm going to lubricate the top of the tubing. Okay, so first I'm going to have you keep your head back, and about halfway through, I'm going to tell you to lean forward and swallow so that it goes down. All right? And remember to raise this arm if you need to stop at all. So now I have you lean forward and swallow. Keep swallowing. All right, it's all the way in to where it should be. I'm going to temporarily tape it while I check the placement. First, I'm going to listen. 30 cc's of air to listen for the gastric burp to make sure the placement is correct. gastric burp. I'm also going to take about 10 milliliters of fluid from the stomach, make sure to clamp it, and then test the pH to see if it's in the stomach. I match it up, slightly acidic, which is good. And then I'm going to measure the length that is out here to document that and for future checks to make sure that it's still where it was before, and send the patient for a chest x-ray for placement as well. And I'm going to document that it was inserted. I am going to also document the patient's response and the length that I measured. I'm also going to check the patient's speech and swallowing. Make sure that they have both of those. And I'm going to provide mouth care every 2 to 4 hours. And this should remain clamped at all times unless it is being attached to something else. Now I will be administering a feeding. So when I come back in, I would wash my hands again, put on new gloves, and check the placement. I would check that the x-ray came back showing that it's properly placed. I would measure this again to make sure that it's still the same measurement as when it was placed previously. And I'm going to listen first to vowel sounds and then the gastric burp again. Vowel sounds are present, so I'm going to do the gastric burp. I'm now going to take out all of the residual, which is about 15 milliliters. Clamp it. Check the pH of this again, and if the residual had been 150 milliliters or more, I would hold the feeding, and I'm going to return all of the residual that there was to the stomach. I'm going to clamp it again, clamp it off. Now I'm going to check the formula that the doctor had prescribed to be given to the patient. Make sure that it's room temperature, check the expiration date. And I am going to first use 30 cc's of water to flush with, and then I will be putting in the formula and then 30 cc's of water again at the end. I'm going to make sure that both the water and the formula never get to the bottom of this so that air bubbles don't get into the patient's stomach. So I'm going to pour in the water, unclamp it, and if the patient's feeling stomach discomfort, I'll lower this to slow down the feeding so that it's less on the patient's stomach. Clamp it before it gets to the bottom, and put in the proper amount of the formula. Let that go in. And then again, flush it with another 30 cc's. would document the type of formula and amount given, the patient's response to it, and document that I did this. I would leave the patient in mid-Fowlers if I left the room now for about an hour, and I would also leave the patient in mid-Fowlers after inserting the NG tube if I had left the room after that. I'm now going to discontinue the NG according to doctor's orders and give the patient a tissue. And so I'm going to discontinue your NG tube. It will not be as painful as the insertion. And untape it. I'm first going to put in 30 cc's of air to flush the tubing. And if I had just come back in the room, I would wash my hands again and put on new gloves. Now I'm going to crimp the tubing and ask the patient to hold their breath as they pull it out. So hold your breath. I'm going to pull it out. I'm going to check the nares. I'm going to document that I took it out, the patient's response, and I am going to check on the patient for GI. I'm going to continue to do GI assessments to make sure everything is working properly now that the NG is out. I'm going to leave the patient in mid-Fowlers for a little while. I'm going to make sure the call light is in reach. Ask the patient if they have any questions or need anything before I leave the room. Make sure they're comfortable.